Good morning, everyone. It is Tuesday, February 22nd. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook, on YouTube, and on Twitter. So you hit your head and you think nothing of it, but it may be something more severe. This morning, we are joined by Dr. Koji Ebersole. He is the director of Endovascular Neurosurgery. He's going to help us know when it is time to get help. Plus, a new minimally invasive treatment being used here at the health system that will likely become the new standard of care when it comes to certain type of brain bleeds. And a patient update with one of Dr. Ebersole's young patients. She too had a certain type of brain bleed that we'll talk about. She's going to join us live to tell us how she's doing. In headlines this morning, several school districts are masking optional as of today. Those include Olathe, DeSoto, and Grandview. This is also the last week for extended testing at one Kansas City site. If you do need a COVID test, you can get one till 6 o'clock each night through next Tuesday at the Bruce R. Watkins Center. The FDA has expanded the use of a revolutionary technology that can detect an internal bleeding in the brain of an adult patient now to include pediatric cases as well. The handheld device called InfraScan technology uses infrared technology to identify signs of a hematoma. The FDA clearance followed multiple studies that demonstrated the scanners used in spotting signs of hematoma in patients as young as 2 years old. The infrascanner was first approved by the FDA back in 2011. New numbers from the Mid-America Regional Council show COVID cases in the metro are falling by double digits. The latest data shows 710 daily average new cases as of February 11th. That is down nearly 41%. When it comes to vaccinations, Mark reports that percentage stands at just under 61%. Johnson County leads the metro with nearly 74% completed and 93% partially vaccinated. 56% of people in Wyandotte County have completed vaccinations, while 68% have started the process. And on the Missouri side, 56% of people in Jackson County have completed their vaccination, while 69% have gotten their first shot. Make sure you get your questions sent in to us this morning on YouTube, Facebook, and at the Medical News Network. You can find links right there on your screen. But first, before we get to our topic today, let's get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. He's joining us with our COVID count. Good morning to you.
Yeah, hi.
Hi.
And just like those MARC numbers, our hospitalizations are continuing to go down. We have 40 active infections today with 7 in the ICU, 3 on the ventilator, still 82 in that recovery period as well. But overall, I think it is good news, and this would be consistent with the trends that we've seen, that hospitalizations follow cases. As we've seen that decrease in cases, we are also seeing that decrease in overall hospitalizations as well.
All right, Doc Hawk, thanks. We'll get back with you here in just a few moments. Let's check and see if there are any reporter questions on the line today. I think we're good to go. All right, we'll get to community questions here in just a bit. Well, it's not something you always think about when you fall and hit your head, bump your head. But as we've learned in the recent news of the death of comedian and actor Bob Sagat, that hit could lead to a brain bleed. Some signs you may have a brain bleed include confusion, difficulty speaking, blood or a fluid coming from the ears. Clearly, you would need help at that point. A hospital test is usually needed to diagnose a brain bleed, but the most common is a CT scan, where a series of X-rays creates a 3D picture of the brain. A 2018 study published on the website The Medical News Today, that shows that more than 20,000 people in the United States die of an intracerebral hemorrhage. Researchers say intracerebral hemorrhaging has a 30-day mortality rate of 44%. So to help us kind of understand what all that means to us is Dr. Koji Ebersole. Good morning to you.
Good morning.
Nice to see you. So we hear that sounds alarming. This whole situation that we've heard in the news with Bob Sagat, clearly there's a lot about that case we do not know, but on the surface of that case, it's somebody falls, bumps their head, doesn't think it's a big deal, goes to sleep. It's pretty unusual, right?
Highly unusual, and unusual enough that it's not something that I think the general public needs to be importantly worried about. My understanding is he had multiple fractures at the back of the head. The back of the head is a sensitive area of the brain. The brain is housed inside of an enclosed compartment of the skull, and if you have an impact that's significant enough to cause bleeding, that bleeding will accumulate inside the enclosed space, putting pressure on the brain. And in an extreme circumstance, such as what must have happened to Mr. Sagat, the accumulation of blood can put enough pressure on the brain that if you fall asleep, it could be the accumulating pressure does not allow you to wake up. I have no doubt that the impact was significant, and he felt it. I think an entertainer's life, as we all know, is extremely busy. He must have been exhausted, and the headache was severe, and he thought maybe if he could sleep it off, he would be better come the morning. Very unfortunate, but exceptionally rare.
Well, we hear things like the head is so resilient, it can take a smacking, but then it also, if hit in the right spot, which we think perhaps this may have happened, just hit in the right spot, that's where it can cause the most damage, right?
Well, I being a neurosurgeon and dealing with this type of pathology day in and day out, I would not say that the brain is resilient, if you will. I don't want the brain to have an impact.
Well, then tell us about that. Because, kids fall. People go, oh, your kid fell off of this, kid fell off of that. Do you really have to take them in? So that's, I think, what sometimes concerns people is how bad is a fall? My kid fell off a swing the other day. You're thinking, okay, well, did they hit the head just right? Is that skull really protecting?
Got it.
So help us as parents understand, or people understand, when we need to take our kid or our spouse to the doctor.
Right. I think if the impact is witnessed and it looks like something that you've experienced yourself personally 50 times in your life, you're probably good to go. But if there's anything unusual about it, say it's a really severe impact and you can hear it, or an impact, I've met children running impacting on the corner of a concrete building, for example. That is severe. And then any alteration beyond the headache. If you have confusion, if you lose consciousness, for sure. If you're dazed, walking with imbalance, if you're getting sick to your stomach and nauseated, this is beyond a simple superficial impact that has effects at the scalp, which may cause bruising, but doesn't extend to concern for the brain. If you're having additional symptoms beyond a headache, you should get screened.
And a headache that's getting worse. So you're saying this is an impact that could happen several days before and just continue over time to get worse, or do you think you would feel those signs immediately, and that's when you would need to get help? Or could it have been something that happened several days ago?
The most typical scenario in the age group that we're talking about, Mr. Sagat or middle-aged adults and younger, the impacts are most likely to be very closely around the time of the injury. The impacts to the brain will manifest in very short order. When you're talking in an older population, it can be that the impact to the head takes multiple days before the brain's function is altered. And that is what you guys alluded to in the introduction about a different pattern of brain bleeding.
All right, so we're going to talk a little bit about that. But there's no treatment that we are trying here as part of a trial, correct, at the health system. And I'm going to pronounce it. It's called meningeal artery embolization. That's a technique or a treatment. And it's going to help. It's minimally invasive. Likely to be the new standard of care when it comes to certain type of brain bleeds, and certainly in older people. Tell us exactly what it is and who this is going to help.
Okay. So a classic subset of neurosurgical patients experience a condition that's called chronic subdural hematoma. It is a slow onset bleeding inside of the skull, and it affects the elderly population because of anatomic considerations. You've got to realize that your brain is finished essentially growing in your mid-20s, and then every year thereafter you're losing neurons. So the maximum size of the brain is in your mid-20s, and it's starting to shrink. So that by the time you're in your 70s, the brain may be importantly smaller than the skull that is housing it. This leaves a potential space where blood can accumulate slowly before you develop symptoms. So it's a pathology that's heavily skewed towards the patients with that type of anatomy. That's elderly folks. So you can experience bleeding on the brain from a relatively small impact, and over the course of several weeks, the classic story is then you start to develop symptoms. The headaches are slowly getting worse over multiple weeks, and then the brain starts experiencing dysfunction because of the pressure. In that situation, for over 50 years, we've been doing the exact same thing, which is a brain surgery operation to make a hole in the skull to essentially wash the blood out with saline to restore the balance inside of the brain. Excellent operation, very effective in relieving pressure from the brain. What it does not do, however, is target the source of the bleeding, which as the brain is trying to heal this area, it's developing new blood vessels, and new blood vessels don't have the same integrity of a mature blood vessel. So those are prone to leaking into this potential space. So despite the surgery, you can get reaccumulation of the bleeding. The new therapy does not require surgery. It is using catheters to target those fragile blood vessels and clog them off because they aren't doing anything useful for the brain and they're only a risk of bleeding. In our early work so far, it's extremely promising, and so important clinical trials are gearing up, and we are optimistic that it will become the new standard of care.
Tell us about the biplane, what it is. We're going to show some video of the biplane.
Sure.
And tell us what it is and what it's used for.
Right. So if you want to image somebody's blood vessels, they're inside the body. You can't see these things with your naked eye. So they use X-ray technology. And you inject dye into the blood vessel system, and the X-rays can pick up the dye. So we're injecting them into the blood vessels, and you can get a perfect three-dimensional picture like this that you can rotate all around and understand this complex anatomy from multiple different viewpoints. For the brain has very complex and twisty blood vessels. So looking at it from multiple directions at the same time is a necessity to do these procedures safely. That's what the biplane angiography suite is. It is a procedural room that allows us to use these technologies to help the brain's blood vessels in a minimally invasive way.
How has COVID changed the way you've handled patients, treated patients?
It's been highly disruptive to our typical workflow. Many of the conditions that come to attention in the vascular space, they need time to work these things up. And oftentimes the symptoms associated with the vascular system, say related to an aneurysm, these things are often found by accident. The patient doesn't even know that they have this. So it's not very high on their list of immediate medical concerns. So when you have something like COVID, which is so important, having a dramatic impact and at the top of the patient's consciousness about their health, other important considerations start going lower and lower on the list. So what happened during COVID? Patients that would otherwise be seeking treatment for their vascular conditions were not coming to the hospital. And so our cases that were planned up front, meaning our elective cases, dropped off in a substantial way. And then conversely, the emergencies escalated because the patients aren't receiving the same preventative care that they would. So when COVID surges, our emergency cases surges, and our preventative cases shrink dramatically. It has been wide swings for our practice, and the emergencies have been dramatic. Not only does COVID impact the health systems regarding the direct treatment of COVID patients, but it's hard for patients to transport from one place to the next. It's hard for them to get an ambulance in an emergency. So if patients are having an emergency brain vascular condition, we're talking about aneurysm ruptures or strokes, it is hard for them to get the same access that they had before. And so we're meeting the patients when important time has already been lost, and our ability to help them through that is importantly compromised.
When minutes matter.
Big trouble.
Okay, we're going to pull off kind of a reunion of sorts here in just a moment with one of your prior patients. So hang tight for that. But I do have a question. So how common are brain bleeds in children? Are they common, not common? You seem to handle a lot of these cases, Dr. Ebersole. So
right. Well, we have an excellent working relationship with the children's team there. But brain bleeding in a child is not a common thing. There is almost always an explanation if this happens in a child. If it happens with no sudden warning, it may well be something that the child was born with, something about their vascular system that did not reach the typical mature state. Or related to a trauma, absolutely. Those are by far and away the most classic situations for a child to experience brain bleeding. This is not a common event.
All right, but it did happen to this patient. Dr. Ebersole helped one Metro family get their daughter back to her old self. She experienced a certain type of brain bleed that Dr. Ebersole will talk more about. It was the scare of their family's life. Watch her story.
A Kansas City family is grateful to have their daughter back to her old self after one of the scariest experiences of their lives. And they found a special way to thank the healing doctor who stepped in to help this little girl.
Well, I'm a softie, so I'm quite choked up about it.
Dr. Koji Ebersole is talking about this bracelet with the word healer printed right on it. Dr. Ebersole is director of Endovascular Neurosurgery, and he's talking about a case that is about as rare as the miracle surgeries that he's performed on his patients.
I sent pictures of it to everybody that I care about.
He received this special gift from a young girl who came under his care.
You feel warm now?
10-year-old Layla Huber was transferred to the health system and Dr. Ebersole's team after undergoing emergency surgery elsewhere to immediately stop the bleeding in her brain.
This was her CT scan when she first went to the outside hospital, having fallen into a coma and having seizures.
Layla was diagnosed with vascular malformation in her brain and abnormal development of blood vessels, which caused her to have sudden severe headaches, which led to a more serious condition.
It became clear that she was harboring a very rare subset of vascular malformation that has an extremely aggressive behavior. So it was imperative to apply a treatment to stop the likelihood of having rebleeding.
Dr. Ebersole performed an extremely rare procedure, only about 5 known cases worldwide, as a catheter technique in which sterile surgical superglue is used to close off parts of the brain with abnormal blood vessels that block blood flow.
It would be a very advanced and substantial undertaking with important risk, but it was high risk, high reward.
It is a miracle. I mean, I tear up thinking about it.
Layla's parents have been right by her side.
Just seeing her from that moment and what we have went through, and it happened so fast.
Now, months later, Layla is doing great, getting back to school, horseback riding, and spending good times with family and friends. But the Hubers know this would not be possible without the man who now wears that healer bracelet.
It's a big release that all of that effort was worth it. And when you see how amazing she did, you just know that everything went right.
To have a daily stress of wondering what tomorrow might bring or what a year from now will bring, we don't have to worry about that, and that's the beauty of it all.
And Layla and her mom, Marcia, are joining us live this morning. Good morning to both of you. It's not even 9 o'clock, and we're crying happy tears in the studio today, ladies. Dr. Ebersole, what's it like to see? Good morning. What's it like, Dr. Ebersole, first just to see the story and to see their faces this morning?
Oh, it's just so great. So happy that we could be there to help you guys, and that the technology has improved to the point that we can do dramatic things and turn a real emergency around. Good for you, Layla.
Layla, how you doing? How you doing, girlfriend?
Good.
Good. You look good. You back in school, and how's that going?
Yeah, it's going good.
Mom, what's this journey been like for you? And tell us a little bit about how this all came to be.
Well, Layla was having a lot of headaches, and that morning when she woke up, it was worse than ever. She immediately went into a seizure. It wasn't until we went to the first hospital that they explained to us that we needed to get her to Children's Mercy fast. And when I saw the scans, I knew it wasn't good. But it wasn't until we got there that we heard that she had a brain bleed and that it resulted because of her AVM ruptured. And we never heard of an AVM before until at that point. So we were quite concerned and worried.
So there had never been any issues up until then, or had she been experiencing lifelong headaches?
She was experiencing headaches and more sleeping. I mean, since she was born, she was an active kid, no naps. So, but during that time, it was COVID, and I thought, I can't take her in for a headache. They're not taking hardly any patients. So I just treated it as a normal headache.
Layla, what do you remember from back at that time?
I was having like bad headaches and I kept on sleeping a lot, and yeah, that's basically like it.
What about your time in the hospital and meeting Dr. Ebersole? What was that like for you?
I I don't know, scary, kind of. I mean, I don't know what's happening to me, so yeah.
Yeah. That must have been really scary. But you had mom and dad there by your side the whole time, and Dr. Ebersole looking out for you. So, Mom, how's she doing today? What's it like to have your daughter back?
She's doing fabulous. I mean, she just doesn't stop. She just teaches herself new tricks, new activities, and she gives it all she has.
You're back on the horse, literally? Back on your horse? Good. Dr. Ebersole, what's it like to treat when a parent is bringing a child and putting, their life in your hands? What is that like for you?
I have supreme confidence in my ability to understand what the problem is. Mm-hmm. And you have to build that level of confidence so that you can convince yourself that there is a solution, and that if you have that level of conviction, I think you start to see all of the details. The central plan becomes so clear that you can see the nuances along the way that will help you to get it done. So my brain functions very well in that setting, in the emergency setting. It can see that the central thing that ties it all together. I don't know why that is. Other things my brain is terrible at. Anything that takes long-term planning, I'm the worst at. But in an emergency, it knows what to do, and over time, I have come to trust that significantly.
You are a big softie, and I know that you always kind of downplay your part in these, but we call these the Koji miracles because you've really been called in to care for kids in some very unusual cases that we've seen in the past. So, ladies, you gave Dr. Ebersole a gift, the healing bracelet, and no surprise, you're wearing it today.
Sure. Yeah. Thanks so much, guys. Yeah, that was very nice. Very nice. Yeah, it says healer on here with the small heart. Layla, I understand she made this for me. I showed it to everyone when I got it. It's very nice.
It's very emotional for you, I know.
It is. I figured that part out about it too. It's all part of what my workflow is. It's just extremely concentrated, and so I think my emotions do not interrupt me from getting the job done. It's just extreme concentration. But then when it's finished, then it's just a flood of emotion, and I can't control it.
We understand. Ladies, I'm sure this is has brought all sorts of emotions for you as well.
Oh, absolutely. I mean, just rewatching the videos or seeing the pictures, I mean, it just takes you back to that given moment. And it's great that we did have a great team that was able to work on Layla and put her where she's at today.
And how has the recovery process been? Are you doing some regular appointments? Are there checkups involved? What will the long-term recovery look like?
I think that's the miracle in itself. At first, we partnered with her school to do homeschooling the first year, and then we had a great OT and speech therapist. I found physical therapy close to home for less transportation. They had a pool to do aquatic therapy, which I found was great for brain injury patients. And she has just been, completely healed. She's doing fabulous. She only has a little bit weakness in her left foot, which no one could ever tell anything has ever happened to her.
Is that how you planned it? It just poof goes away? Is that what you thought would happen?
I think part of the reason why the stories are so interesting to the public is that with these new technologies, you can solve a life-threatening problem in a minimally invasive way, and so in short order, a person can get back to recovery and doing what they want to do, especially children, because children's brains are still making connections. They're still wiring, and so they are so resilient. Their ability to overcome a change to function is well beyond what ourselves as adults with hardwired brains are capable of doing. So very dramatic circumstances can have an absolutely outstanding outcome, and it makes it extremely rewarding.
So if we went back 15, 20, 25 years ago, how would Layla's case been handled?
They would have tried surgery to try to cut out the abnormal blood vessels. It would have been exceptionally difficult. She would for sure have been sent to the most important center in the region at the time. And there would have been important blood loss at the time of surgery trying to control it. And so the smaller one's overall blood volume is, meaning in a child, the more dangerous that can be. It would have taken all day, and it would have been extremely dramatic. These days, surgery is reserved if it cannot be achieved with catheters.
All right, we're going to get to some community questions, but before we do, I want to ask you, because we've talked about different types of brain bleeds. We talked about a traumatic event where you may not know that it's serious. We talked about brain bleeds due to shrinking in the brain as you age, and then we of course talk about Layla's case. So tell us a little bit about the differences and how we should know and how we should move forward if we think we may be experiencing any of these.
Boy, it is a very wide set of pathologies. There's many different patterns of brain bleeding that can occur for innumerable causes. The most classic pattern is following injury. If you have an important impact to the head, that is beyond simple headache. If you have progressive headache, if you have the development of confusion, or you black out, or you feel off balance, your vision is obscured, you should have an evaluation to see if it's possible that the impact was strong enough to cause bleeding on the brain. Traumatic brain bleeding is a very common category. The other forms are triggered by pathologies directly related to the brain. And for the most part, they elevate in frequency as we age because our blood vessels experience wear and tear over the decades, and their resilience becomes compromised as you age. So you're more prone to bleeding from a small impact that we talked about related to shrinking of the brain, or from bleeding from small blood vessels inside of the brain. These things typically manifest themselves with obvious dysfunction of the brain, and you don't have to question whether there's something wrong there. The other form is sudden bleeding, typically related to a weakness in the blood vessel, an aneurysm, for example. And there is no mystery related to this. You won't be wondering, did I have an aneurysm? You won't have time to have that consideration. Aneurysm causes the worst headache you've ever had in your life with very sudden impact. They call it a thunderclap headache. The intensity will be maximal in the first 10 seconds of its onset.
Not a regular headache, not a migraine.
No.
It is clear and far different from anything you've ever experienced. Okay, I do want to get to some community questions. We've got a few. Dr. Ebersole, Erica and Alyssa have similar questions. Erica is asking about what does it mean to lose neurons? And Alyssa, just curious about the brain shrinks. I think they're connected, so explain that again.
Yeah, the medical word is called atrophy, which all of our tissues in the body go through this. They are dynamic things, and so if you're lifting weights, you can make your muscle mass increase, but then if you stop doing it, the muscles will atrophy, meaning lose volume over time. The brain is going through this exact same thing. It reaches a peak in terms of its number of neurons somewhere in the mid-20s, we believe, and then over decades, it is shrinking over time, meaning neurons that aren't having as much use as others are being pruned so that your overall volume in the brain is decreasing. An elderly person's brain has importantly less volume, importantly less cells than a young person's.
Okay, I want to ask a question from Ashley. If your toddler falls out of something, like a shopping cart, for example, hits their head on the ground, but is acting normal and has calmed down, do you still suggest a visit to the ER?
I do not. I think if your child looks like that they're perfectly happy and back to themselves, I think we can consider that to be routine. But let's say the child is becoming more sleepy, not feeding anymore, not happy, now irritable, and now throwing up, not keeping food down. Absolutely. I would give your pediatrician a call, and if you can't reach them, I would consider an emergency room visit.
Vicki wants to know, if you have a relatively minor accident that results in a small brain bleed, do they sometimes heal themselves without intervention?
I would say that the vast majority of brain bleeds do heal themselves on their own. Even the ones that are big enough to come to my attention, the brain will heal them with time. The question is there something underlying there that puts you at a risk of ongoing bleeding or future bleeding? Do we need to do something about that? But bleeding in the brain will stop because it is an enclosed area, and so the pressure stops the brain from bleeding. It is rebleed that is the focus of a lot of our attention.
Karen says she fell on November 15th and had bleeding on the brain. I was in ICU overnight. Since then, have been diagnosed with white matter disease. What should I do for my future health? And what is white matter disease? That's another question.
Right. White matter disease is a catch-all phrase for changes in the brain that are thought to be related to the very smallest blood vessels in the brain. These blood vessels are so small that we don't have a direct imaging technology that we can use to see them. But we can see the signs that those blood vessels are experiencing wear and tear over time. So this is, again, a condition heavily weighted towards the elderly population. You will not see these changes in a young person. They accumulate over multiple decades of life. How do you protect yourself from this? It is important to keep your body as healthy as possible for as long as possible. So having regular checkups with your doctor for preventative care. When your doctor is talking to you about things like high blood pressure or diabetes or cholesterol, these are all things that you may not feel the impacts on a day-to-day basis. But if you add those conditions up over years and they aren't well attuned, they will lead to wear and tear on your blood vessel system, and it can result in innumerable things throughout the body. And the most important areas are heart and brain.
A few more questions. Marcia, one for you from Nancy. Are you extra careful now when it comes to Layla? Have you learned to let go, or do you handle her with the kid gloves?
I learned to let go. I knew once I heard from Dr. Ebersole, she's good. And I took full confidence in his words, and we have just let her soar like an eagle and do anything and everything that she wants. We do take precaution with helmets for bike riding and her skateboard, but other than that, she just conquers and divides.
What was it like going through this during COVID? I think when we met, we were all masked up upstairs during this time. The last thing you want to be going through is this, but during a time of a pandemic, what was that like? Did that had to have had some extra stress?
It did. I think that the hospital was, they were taking their precautions, and we were just in the middle of it all. But they carried on. They did their job. They did what they needed to do. I think that was just an aftermath for what was actually going on with Layla. And so you did see the inside of the hospitals and what they were dealing with, but they separated the two and handled each one very carefully.
Layla, I know you're so active. What was the one thing you were most excited to get back to doing after all of this was behind you? What did you miss the most?
Horse riding.
That makes sense. Did you miss school? Did you miss seeing your friends?
Yeah, I did, because, I don't really like my mom as my teacher.
Hey, my kids feel the same way. I get it. That's okay. Moms are supposed to be moms, not teachers. So
Yes.
Good to know. Dr. Ebersole, Jason was curious, how do you check your brain? Like a brain screening, like we scan and screen every other thing in our bodies. How do you know you just go until something happens? It's kind of scary, especially when you talk about aneurysms. But can you just go and say, hey, check my head out, doctor?
If you go to your primary doctor and simply ask them for a screening scan of the brain, you will be denied. And that would be appropriate. You need to have a specific reason to look at that area of the body. This would not be any different for any other area of the body. You can't go to your doctor and say, "Can I have a picture of my elbow?" And they say, "Why?" And so I just want to see what the answer will be no.
Just because it's not a good answer? You can't just say
because
just because?
is not a good answer. Now, if you're having symptoms that are suggested to be related to the brain, that's a completely different situation. And when you present that to your primary care doctor, then the investigation will begin. And there's multiple different ways to look at the brain with imaging. And so depending on what they're trying to understand, they'll be very careful about choosing which study to start with. So in an emergency, it's very easy oftentimes. In an emergency, you quickly want to know, is there blood there? And how do you figure that out? With the CAT scan that takes less than a minute to acquire. But in an outpatient setting, when you're working with your primary doctor and there's no concern for a sudden event, the decision-making is more sophisticated. You may be taking a consideration for a test that's provides a lot more information than a CT scan, but takes a lot longer to acquire as well. So there is no one-size-fits-all. Mm-hmm. It's a back and forth with your doctor.
Okay, but no, just check my head.
That won't happen.
Not going to happen. But we can feel that way sometimes, can't we? Okay, so Joellen has a question very similar to Jean's question. Jean wants to know, is there something you can do to lessen the speed of neuron loss as you age? And Joellen is asking, are there things like word games, word searches, things that can help slow the loss of brain cells, or is it just simply inevitable?
There's an element of it that is inevitable. This is a natural part of aging. Now, I absolutely believe that exercising your brain is no different than exercising your body. If you don't use it, you lose it. The more you're asking your brain to do, the longer it's going to be able to do those things. But keeping your body healthy from an early age, regular follow-ups with your doctor, so they're keeping track of these conditions that you cannot feel on a day-to-day basis, but over a lifetime will add up to important changes. That's very important. For me, I've been in the medical field all over different parts of the United States during this long training process and practice process. And I've come to understand that here in Kansas, where we're dealing with patients coming from more rural areas, oftentimes their level of understanding about these things is different than somebody who's bombarded with daily reminders about eating right and doing things organic and let's go be vegan, these types of things. So it's not uncommon for patients to be quite surprised to know that these things add up to changes to their blood vessels, and that's the reason why they were so important to begin with. High blood pressure in and of itself is not an important isolated thing. It's important because it adds to wear and tear of your blood vessels, in particular for your heart and brain that can have life-altering circumstances.
And this is why we want you to check our heads.
Exactly.
Okay, last question is from Kim, and I had not heard of this. Maybe you have. What is Pick's disease?
Pick's disease?
Pick's disease. Are you familiar?
I believe they're referring to a subtype of dementia.
Okay.
Which those conditions, it would present with typically a person who's older in age, who does not have the same mental capacity that they felt that they had in the past. And they're starting to wonder, is this a normal part of aging, or is this happening at a rate that's accelerated for my particular age? And you start that conversation with your primary care doctor. And if the primary care doctor is importantly considering the dementia spectrum of conditions, they may well connect you with a neurologist who are the experts for that condition.
All right. Great questions today. And great guests. So we're going to get some final thoughts. And ladies, I'm going to start with you, Marcia, Layla. Just some final thoughts from you. Maybe some advice to parents about when to know and how to know your body and your kid's body. And then maybe some final words between you and Dr. Ebersole.
Yeah, just listen to them. I mean, I think knowing now, looking back, with her having a lot of headaches, I probably should have just went with my gut and went into the doctors. So just listen to them, and if they are having multiple more than normal or sleeping, like Dr. Ebersole said, then just take them into the pediatric and let them get checked out.
And any words to Dr. Ebersole? Because I guess you guys don't see each other that often anymore, for good reason.
That's a good thing. But yes, we, like I told you before, we truly think of you as a healer. You are amazing at your work. You have brought so much for us, and we can't thank you enough.
Thanks so much for having trust in my team to help you guys through a tough situation. I think everybody's so proud of what you've done, Layla. Good for you.
Thank you, ladies, for being with us this morning. Be well. Dr. Ebersole, just final thoughts. What do you want our audience to know just about head health, brain health, and taking care of ourselves during this time?
Oh, I think we've mentioned a couple of times that if you are hoping to keep your brain health optimized for as long as possible, it is a long-term commitment. It is a lifestyle commitment. It is paying attention to things that you can't appreciate on a day-to-day basis, but understanding that the commitment to it adds up over the course of a lifetime. The brain is an amazing part of the body. I think it's the most important part. And it behooves you to keep it healthy. It will tell you if there's something wrong and there's something emergency. If that's the case, don't hesitate to call 911. But for the most part, it's a precious thing. Work with your primary care doctor, work on your preventative health, and try to eat right, exercise, and live a long and happy life. Exercise your brain.
Great advice from one of our very favorite healers here at the health system. Thank you so much. Dr. Hawkinson.
Yeah.
Hi, how are you?
Good. I'm just going to echo what Dr. Ebersole said. You know, I think this has been a great show, and it just kind of continues to emphasize the fact that other things continue to go on. Our health is, much more than obviously COVID. We have given a lot of time to that, but we've always also emphasized the fact that please get in to see your medical teams, do your physical exams, meet with your physicians on a regular basis to keep yourself healthy and those preventive measures going. I think that continues to be vitally important as well.
All right. Thanks for those final thoughts today. And thank you all so much for being with us. Coming up tomorrow, the role your stomach plays in determining how severe your case of COVID could be. A new study finds the bacteria in your gut plays a big role in protecting your body from viruses. And so far, it appears to be the same with COVID. We'll break all that down coming up tomorrow at 8 with Open Mics with Dr. Stites. Have a great Tuesday. We'll see you tomorrow.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.